First of all, thank you for this report. I was saying before we came in here that it's so difficult to find information about what we know to be our lived realities. Often you find information on perhaps women, you find information on disabled people, you find information on Black and ethnic minorities, but rarely is it that there is an intersectional look at these types of issues. A few years ago, the JRF did a report on poverty rates in the UK, and it said that Black and Bangladeshi and Pakistani folks were living in the deepest poverty in the nation, and that disabled folks or families with a disabled child or someone disabled in the family were living in the deepest poverty, right? And so when we look at this report and I'm seeing, okay, well, disabled women are experiencing this percentage of decline in what their earnings would be, or they're experiencing this amount of loss, and Black women are experiencing this amount of loss, I can't help but think what that looks like put together, right? And what that inequity looks like in real terms. And one of the things that happens when you're in a society where people are already struggling based on what we are calling the cost of living crisis, which is a wild dystopian term to use for existing, people become stressed, and the folks who are carrying the care economy are women who are living in the poorest percentile, right, of the population. With that being said, as disabled folks who are reliant on public services, who are reliant on state benefits, you often become the scapegoat for the frustrations of economic inequity in a society, right? So if we're talking about women being unable, because of these economic inequities, being unable to leave domestic violence situations, because of this economic uncertainty and that being an impact, we have to then think, what happens when you are disabled in that situation? Disabled women experience higher rates of domestic violence, and actually Black and ethnic minority women, especially Black women, experience high rates of domestic violence unreported because of so many barriers. So what if you're a Black disabled woman? But then also, because you're reliant on the state and social security and social care, for people who are pushed to their edge and pushed to the limit, coming into your homes perhaps, or assisting or partaking in your care, you become a sitting duck for their frustrations as well, right? And suddenly we're in a state where those who are suffering the most from the government cuts and all these inequities are experiencing you can't even call it infighting because it's one-sided, right? You are then not focusing on actually what the real problem is. You are then a scapegoat for those frustrations. So there are lots of disabled people in times like this who experience an uptick of violence within their homes and in their communities, not just from spouses and partners and brothers and sisters, but also from those who are part of what we are calling the care economy. So just in a real world sense, that is one of the things that happens. And so it's important that we are thinking of, if we are trying to improve services, if we are trying to turn our economy around, what does it look like to cater for or to protect the most vulnerable people within a society? I think often we think that because we're talking about, this is a white majority nation, full stop. And sometimes what happens is when you start mentioning ethnic minorities and folks who are marginalized in different ways, folks go, yeah, but that's not the majority. We need to look after, the majority of people first, right? Aren't just poor women suffering and one of the things that I will always I'm always reminded of, and I'm not the person who coined this, and I've forgotten who did. I hope they forgive me if they ever see this, but disabled women who live in the margins are the canaries in the coal mine. Whatever is happening to the folks who live at the most marginalized intersection you can think of in your nation are a representation of where your nation is actually at. And if you do not rectify the inequities they're experiencing whether we're talking about the intersections of racism and sexism and ableism, right? It is going to come back to haunt you. We saw this with COVID-19. There are people who've been talking about these inequities in healthcare, talking about racism in the system, and there's sexism, and actually looking at how we treat our elders, right? And folks were just ignoring it because it's not necessarily affecting me in the majority. And so one of the things this report does is say, actually, this is the rot and this is what we need to fix. And so for me, it's confirmation of what disabled folks in all iterations have been talking about for well over 15 years, right? Because a lot of them saw it coming and have been campaigning and mourning. But also, it is a good way for us to think about moving forward. What do we need to do from here, and who do we need to be listening to, and who do we need to be incorporating into our solutions? So that's where I'm at with the report. I agree with the intergenerational idea, because at both ends of the spectrum, and I would even go further down beyond young women into children, because both the youngest and the oldest members of our society are incredibly vulnerable. And I also want to give mention to the point about homeless folks and sex workers, right, being not necessarily included in some of this data, which, if we go back to what I was saying at the very beginning, it's super important that we are capturing data that looks at those who live at the margins of society, so that we can plug all the gaps. So overall, this is a good report, but it's what we do with it. It's how we maneuver through, and what your government decides to do, but more importantly, how we imbue this into it, because there are lots of people from different organisations here, and so what are we going to do with this information, and how will we move forward? Like I said before, racism, sexism, ableism, guys, foundational. If you look at any of these things, any of the measures that are brought into place, once you look at them from that lens of oppression, you understand what they're based upon and how you can change society for everyone, right? So keep that in mind.
Thank you. Thank you.
I will say, however, is what I think can be a barrier, and I think this came up because of the mention of sanctions. One of the things that happens, especially with when we're talking about benefits, social services, is we have a communications issue, and so there is a perception of what they are, and then there's the reality of what they are, right? And so in order for when change is happening, when they're going to bring in these policies, when they're trying to do the surveys, and when they're trying to get people to agree to some of these punitive measures and the hyper-surveillance, even when it comes to receiving benefits, is that there is a joint media effort to push whatever narrative will fit the end result that the government and those higher ups are looking for, whatever is going to allow them to scapegoat whichever community. The disabled community have experienced this for years. This whole idea of benefit scroungers, pretty much fake, right? But it's communications. How many news articles do I need to put out before people start believing that actually the reason why social services are on its knees is because of all of these poor people who are just scrounging off the system, right? Because that's what all of our budget is going towards. It's funding their Mercedes-Benz lifestyles and holidays to Mallorca. That's literally what's happening. And so one of the things I think organizations who are on the ground have to do is think about their communications and really kind of combating the misinformation that is going to be happening, because the harder things get, the more aggressive that misinformation becomes, right? And so that's one of the things. The other thing, in terms of how we approach those issues, is looking at those organizations on the ground, those community organizations who have been doing the heavy lifting in lieu of the government doing their job, right? All of the organisations that have been in communities working with women, working with migrant communities, working with folks who are facing domestic violence, feeding mothers and their children at food banks, the folks who have been doing that work and creating this communal care system and working out, okay, what are the loopholes in this system that will allow us to survive? Those are the folks that the government needs to be funding and looking to, and policymakers and unions and need to be looking to work with in order to, A, help to fix the communications issue, because who better to let you know how to communicate to the general public than those who are in contact with them, but also to inform policy and inform interventions. And so that's literally, I think, one of the things that we're going to have to deal with, because this report in itself says all the things in a lot of ways, and not so many words that we need to know in order to know what needs to be fixed, but it's how then to get that communicated. And I think sometimes we have the presumption that those who are in the annals of power have some sort of better understanding of these issues than some of us in this room do. And I will say to you for free that there are a lot of people who are sitting in seats of power who have no clue, couldn't even understand this report if they read it, right? But they're making the decisions about how we live and how we move forward, and what rights women deserve, and what rights migrants deserve, and all of this kind of stuff. And so we have to kind of think of things, and as disabled women and folks have been doing for a while, think of things outside of the paradigms of, okay, well, these people are going to do the right thing. They're not. They haven't been. And so we have to force their hand by utilising the resources at our disposal, which is us, right? I'm going to go with the simple question. I don't know how you get men in the room, so I'm going to move swiftly through to. In terms of research and the kind of research that needs to be done, right now one of the issues that exists within, at least if we're thinking about academia, because a lot of policy and those types of things is driven a lot by what is done within academia. A lot of it is not led by folks who are from the groups that these issues concern. And that's one of the main issues. And so what happens is that there's a lot of lost nuance and understanding, and actually not an understanding of what's going on the ground. And there's a whole conversation that could be had on why academia is like that. But what I will say is that what is required, I think, is more investment into disabled folks who are from minoritized backgrounds going into research and academia and making that institution more accessible for them. One of the barriers, and a lot of the barriers that disabled folks face, involve institution, right, and being barred from access to institution, whether that is physically or figuratively, the idea of whether you belong in a place, the idea of whether you are someone who should know or can know, and then also if we think about access, do these institutions have flexible ways of understanding how people contribute to academic work? Are they able to facilitate different ways of working, different ways of presenting thesis, different timelines that would accommodate different ways of existing? And so it beyond just let's get more people doing the research, it has to be folks who are insiders, because I can go and collect all the data from hundreds of people and not understand it, which is often what happens. Folks will go and get data on women, data on different ethnic groups, and not be able to interpret that data in order for us to use for policy. So it's very important that that's one of the things that's done, but also beyond that, the other issue that is faced in terms of research is publishing. Often what happens is those who are able to publish or get their data published are, or cited in order to be used for these policies and for these interventions, do not come from those same backgrounds that we're talking about. So even if the research did exist, getting it into the world and getting it to the people who are doing and collating these kinds of reports is also difficult. So I think it's a question of, yes, investing more into getting folks from those backgrounds researching and doing certain research. There's a lot of wisdom in the margins as well, so I think that's a thing. But fundamentally, and maybe this is a bigger question, and perhaps I thought I was taking an easy question, but it's not, is we kind of need to get rid of racism, sexism, and ableism. Change everything, guys.